Hi everybody. I proudly serve as Executive Chairman and CEO of Leonhardt Ventures and Leonhardt's Launchpads. My name is Howard Leonhardt. Happy to give you an update on our exciting progress so far in 2022. I want to start off with our heart and cardiovascular group, which is where we all started. Walt Disney often said it all started with the mouse. For us, it all started with the heart. Leonhardt had exciting progress this quarter, moving into large animal studies with what we believe to be the first product with high potential to be able to totally regenerate hearts. The first total heart regeneration product ever developed. This is a combination of an implantable pump that goes under the skin that's refilled daily with a combination of muscle stem cells, Coulter expressing MSCs, platelet-rich fibrin that's bioelectrically pre-treated, secretome from amniotic membrane sourcing, exosomes, microRNA gel, and other growth factors that all serve to help promote muscle building within the scar tissue of a heart. We believe that we can create about 3 new strips of muscle every week and keep that going until we completely remodel the heart and reestablish the scar tissue back to beating, pumping muscle the way that it was before the person had the heart attack. We had our first large animal feasibility study that began in San Diego this month, working with Dr. Patrick Griffith and Dr. Leslie Miller and Dr. Doris Taylor, consultation from Dr. Timothy Henry and Dr. Nick Kronos. A great team to move that project forward, and we look forward to share with you the results later this summer. Another exciting project is pressure stim in our heart and cardiovascular group. We're enrolling in our clinical trial in Brazil at this time. We've had a very close dialogue with the folks at University of California, Irvine, led by Dr. Shaista Malik, who is a special advisor to our company. At UCI, they've enrolled more than 200 patients in clinical trials using bioelectric acupuncture to treat high blood pressure or hypertension. We are doing a study in Brazil where we're not using needle acupuncture, we're using gel electrodes in specific strategic locations in the body to attempt to reduce high blood pressure. There's a great need in the marketplace to have a way to treat hypertension or high blood pressure without drugs. The drugs that are available do have a certain amount of effectiveness, but they come with side effects which include fatigue. So a lot of people that get their high blood pressure medicines, they don't want to take them because it makes them tired. What we've noticed so far in our early interim results with bioelectric treatment of blood pressure, which by the way, we have multiple issued patents for this and new patents which are pending. What we're seeing from the early results is we can lower the high blood pressure just as much without drugs, without side effects, as being achieved with the drugs that have side effects. We look forward to sharing with you more data later this summer. A third exciting project within the heart and cardiovascular group is Valvublator, the first technology ever developed to regenerate heart valves. This is to decalcify a heart valve and then regenerate a heart valve with a combination of bioelectrics and biologics, just like we're doing for the whole heart, but this is focused on the heart valve. We believe that we can change the paradigm. Right now, if you come into the doctor at age 40 or 50 or 60 and you have calcification built up on your heart valve, right now they don't do anything. There's nothing that they can do. And they just wait and wait until your heart valve is so bad that you need to have a surgery to place a artificial valve in, or what they call a TAVR procedure, which we helped pioneer back in the 1990s with a very early patent. And that TAVR is a technology using a catheter to deliver a heart valve that's either made of cow tissue or pig tissue or plastic. Most any person who's worked with heart valves and heart valve patients their entire life will tell you that they're much better off keeping their own heart valve made of human tissue than to get a cow or pig or steel or plastic or cadaver heart valve. And our technology at Valvublator is designed to help people keep their own heart valve. This is a reoccurring theme throughout our entire technology, is helping people to keep their own organs instead of getting an artificial implant. Valvublator just completed their 3rd round of prototype building with adjustments made, working with Oscor Medical in Tampa, Florida. They built for us a 3rd generation prototype that now is getting ready to go into large animal studies with the hope that we're going to do the first in human trial, the very first percutaneous, non-surgical heart valve regeneration procedure ever done in mankind. Our target is to get this done by December. Another exciting technology in the heart and cardiovascular group is Second Heart. Second Heart Assist spun out of our accelerator, but it's still a very important part of Leonhardt Ventures, which owns about 20+% of Second Heart Assist, and still supported by our accelerator, even though they're a postgraduate. Second Heart is just finishing their final test, which they believe to be their final test to be able to get the FDA green light to begin a cardiorenal syndrome heart failure study at Cleveland Clinic and Ohio State University. This study will be the first done that is a percutaneous delivery of a system that has low RPMs and high flow. And this is a device, a stent, with a pump inside of it that's placed just above the renal arteries. It's very similar in design to the stents that we developed previously at Leonhardt Ventures back in the 1990s that today is the market leader for repairing aortic aneurysms. We basically took that same aortic stent and we put a pump inside of it to try to help people that are accumulating excess fluids during heart failure to get rid of those excess fluids rapidly and to puff up the kidneys and get them functioning again and to keep the people out of the hospital. And especially patients that are diuretic resistant. Diuretic resistance means they're taking medicines to relieve the excess fluids in their body, excess water in their body, and it's no longer become effective. There's certain patients that they take Lasix, which is a diuretic drug, and at first it works pretty good to kind of dry them up, get rid of the excess fluids that's in their lungs, that their hands are swelling, their feet are swelling, but after time, for unknown reasons, certain people get diuretic resistant. They take the same pill that worked originally for them and it no longer works. So they just keep accumulating, they have a hard time breathing, their hands swell up, their feet swell up, and their kidneys start shriveling up and not working very well. What the Second Heart Assist technology does is put a high flow right above the renal arteries that feed the kidneys, and it quickly pushes all the blood through there, gets rid of that excess fluid, and then also helps revive the kidneys. During that time, it's also relieving the heart of workload, because now that this product is in, appropriately named Second Heart, it's almost as if the person for that time period has a second heart. And Second Heart Assist has patented and is bringing to market the very first technology that features wireless power with a waterproof vest that the patient can wear when they swim, when they take a walk, when they take a shower, and they don't have to be connected. Our competitive system has a line going out to a motor, and if the patient wants to move along, they have to take a cart with a motor, which of course is not a very good quality of life, and for the most part, people can only have that technology of our competitors while they're in the hospital. With our technology, they can go home. They can wear it wherever they're living and doing whatever they want to do. Our next exciting group to give an update on is our brain group, which made enormous progress in discovering new bioelectric signaling sequences last fall, which we announced, for the promotion of brain-derived neurotrophic factor, serotonin, klotho, and other key proteins that are known to improve brain function and to help with brain recovery. Our first target that we're moving now into both a new round of preclinical studies as well as preliminary feasibility clinical studies is depressistem. Depressistem is a band that goes on the head, and it stimulates to release certain proteins to treat depression. During this long extended pandemic, it's well known that depression greatly increased. People don't like to be isolated, and it's continued on as the pandemic is relieving. The effects of the depression epidemic continue. It's estimated that as high as 30% of people are suffering of some sort of depression. And just like we described with the blood pressure drugs, a lot of the drugs that are used to treat depression have side effects, and some are undesirable side effects. So far, we've seen with bioelectric stimulation treatment of depression, there's less side effects. We look forward to sharing with you later this year both the preliminary clinical trial results as well as the results of new studies that we're doing to determine dosing and new signals that are being done in preclinical studies. Another exciting area for us is our cosmetic and personal care area. Orthodontocell had the exciting news just this month that the first clinical data was published in the Journal of Oral Research documenting the ability of the orthodontocell technology to be able to reduce dramatically the time to straighten teeth. Align Technology with Invisalign, that probably everybody has heard of, is the industry leader, a company that has reached as high as $79 billion in valuation. They take about 18 to 24 months to straighten teeth, and they have about a 30% relapse, meaning the teeth go back to being crooked again after you've spent your $4,000 to $6,000 and after you've labored 18 to 24 months to try to straighten your teeth. they go back to being crooked again. Our technology in this study that was published showed 60% of our treated patients with our patented orthodontocell bioelectric stimulation technology that controls the expression of key proteins related to accelerating teeth movement and stabilization. Rankle for accelerating tooth movement and OPG as the star protein for stabilizing. We demonstrated that we had 60% of the patients with perfectly straight teeth at 3 months, and 60% of the patients with perfectly straight teeth, 60% of the patients with perfectly straight teeth at 3 months, 40% of the patients with perfectly straight teeth at 6 months, meaning 100% of our treated patients perfectly straight teeth at 6 months, compared to the control group that had average of 18 to 24 months to straighten teeth. We're about to have an exhibit booth at the annual meeting of the Association of Orthodontists in Miami, May 21 to 24. If you're in the area and you're interested, please come by our exhibit booth, and we have some exciting new data to share. We're also launching in Brazil a new study, the first study to focus on stabilization, stopping that relapse. We believe with our technology we're going to reduce from 30% relapse rate to under 2% relapse rate with our bioelectric controlled expression of OPG, BMP9, and other key proteins. Some of the other updates in the cosmetic area: SkinStim is enrolling vibrantly in a US clinical trial. We've been able to demonstrate in our laboratory right here the ability to control the expression of collagen 1, collagen 3, and Col17A1, a protein that was highlighted and heralded in Japan last year as perhaps being the most important protein ever developed or discovered to be able to affect the skin regeneration. We also have greatly improved our ability to improve troponelastin and elastin. We achieved what we believe is an all-time world record this past quarter of 17% increase of troponelastin and elastin with our patented bioelectric stimulation technology, or I should say patent pending. This is the only technology that we know of with bioelectric stimulation that's able to increase the level of elasticity in your skin and your organs. Most people lose the expression of troponelastin, the precursor of elastin, at puberty and never are able to express it for the rest of their life. We've filed a patent and provided data to support that patent on the first technology ever to turn that switch back on. Another important development is MyoStim-ED, and it's a RectiStim technology. We've completed 115 patients so far. Over 80% of our treated patients have had satisfactory results in treating erectile dysfunction with bioelectric stimulation. This patented technology grows permanent new blood vessels that are not leaky, regenerates muscle and regenerates nerve, and improves the communication channel between the brain and the organ, all of which have led to clinical results that seem to be superior to any of the other technologies tested. Most of the other technologies for erectile dysfunction treatment just focus on temporary improvement of blood flow. Sometimes they focus on recruiting stem cells to the site through injury. None of those other technologies seem to put it all together. They don't seem to regenerate muscle, they don't seem to regenerate nerve, they don't seem to improve the communication between the brain and the organ, and if they do create improvement of blood flow, it's temporary. We create permanent improvement of blood flow, permanent improvement of muscle, permanent improvement of nerves, and permanent improvement of communication between the brain and the organ. Another exciting technology in the cosmetic and personal group is stem cell bra. We just completed a study in Spain. We don't have the published results yet, but I can tell you the early interim results are pretty exciting. About 1/3 of the patients treated had 1 cup size improvement, just stimulating 1 hour every other day for 4 weeks. They were able to increase the volume of their breast tissue by 1 cup size. The other 2/3 of patients didn't have that amount of improvement. We don't have the final results yet, but look forward to share with everybody the final results from this feasibility study. And by the way, that feasibility study followed a previous safety study at very low dosing to establish safety, and before that 16 large animals where we very carefully documented safety, including histopathology in those animals, to make sure that this was safe to go into humans. And by the way, that whole process took about 5 years to complete before we got to this first ever efficacy clinical trial. Another exciting development in the cosmetic and personal care group is what we call BODSTIM. BODSTIM is a suit that is able to help muscle building enhancement and muscle atrophy recovery, and it does that through the controlled expression of our patent pending signals for increasing Klotho and follistatin. Klotho also seems to have many other health benefits, but right now under the FDA clearance it's cleared for stimulating muscles for muscle enhancement, and we are working to gather more data to be able to broaden our indication of use. We really think that this is going to be a special technology. Looks like a wetsuit or a yoga suit, and it's filled with electrodes, and you put a stimulator in the pocket about the size of a cell phone, and just stimulating maybe a few times a week, we've demonstrated the ability to increase circulating clotho by as much as 150%. And circulating clotho, we first established that technology inside of our company due to its muscle regeneration capabilities. Same thing with the follistatin. So we think this is going to be a real exciting technology to take further into more advanced clinical trials, and look forward to share with you the results. In our major organ group, we're proud to share that we got Institutional Review Board approval to start our third clinical trial for iCell. This is our bioelectric technology for improving vision. We're going to focus as well on increasing clotho in those patients, because we do believe that people that are lower on clotho lose their vision more rapidly than people that are normal or higher levels of clotho, and we're going to be able to prove that out in these clinical trials. Kidney cell and bladder cell are enrolling vibrantly in the clinical trials within Brazil. We've already published our first early feasibility study with bladder cell. We look forward to share with you the results of bladder cell 2 and bladder cell 3, two new clinical trials with using bioelectric stimulation to treat bladder dysfunction. And kidney cell is focused on treating patients that have kidney failure. We finished one early safety study. Now we're moving to a safety and efficacy study with higher dosing, and we look forward to share the results with you later this year. Orthostim is in that product group. Orthostim is a knee brace that stimulates the knee to reduce pain, reduce inflammation, to attempt to regenerate damaged cartilage, damaged meniscus, and to strengthen the muscles around the knee. We're just about to launch a clinical trial in Brazil for the Orthostim technology. The final thing I want to share with you is our progress with cancer. Cancer Cell, our startup, has 10 issued U.S. patents from the United States Patent and Trademark Office. These cover a variety of different ways of using bioelectric stimulation to treat cancer. Our most recent issued patent this past November covered reading a cancer tumor, custom designing the signaling from the bioelectric stimulation device to jam the communication of the tumor, to change the surface proteins of the tumor and the charge to be able to elicit an immune response, and to also release proteins that starve a tumor of blood supply. There's also a bunch of other claims in those patents, but those are the big ones. We're really excited to be moving to our second animal study with this technology, as well as instituting a clinical trial using the BOD-STIM suit specifically for cancer. So this study would focus on just increasing circulating clotho. If you type in Google or PubMed, clotho and cancer, you'll find about a dozen papers that establish that clotho has very strong tumor suppression capabilities, or anti-tumor growth properties to it. We are going to move into limited early feasibility clinical trials right now to see if increasing the clotho with our BOD-STIM suit by up to 150%, if it has a beneficial effect in suppressing tumor growth. Look forward to share those results with you. Again, 10 issued patents already with Cancer Cell with the United States Patent and Trademark Office. Dozens and dozens of new claims pending. We're really excited about our position there. We think we have the preeminent intellectual property position in the entire field of cancer. We think that it's going to be proven out over time that bioelectric treatment of cancer is going to be just as effective, if not more effective, than chemo and radiation, with far less side effects. Thank you everybody for listening to the update. We look forward to presenting to you additional updates later in the year. Howard Leonhardt from Leonhardt Ventures and Leonhardt's Launchpads. Thank you, everybody.